Good morning, everybody, and welcome. My name is Linda Govan, and I'm the West Vic PHN Regional Senior Manager for the Ballarat Goldfields region, and I'm speaking to you this morning from Wadawurrung country, and I would like to acknowledge the traditional owners of the land and pay my respects to the elders past, present, and emerging. I will be facilitating the primary care stream today. So you'll be pleased to know that just by joining the session this morning, you've already scored 10 points towards the prize that we'll draw later today. And by staying in the session for the entire duration, you'll receive another 10 points. So first of all, welcome to our first session for today, the Nurse Clinic Building Blocks, explaining the essential elements of a nurse-led clinic with Jo Millard and Margaret Dempsey from APNA. And also thanks to AbbVie for sponsoring this session. And remember to pop over to the Sponsors Lounge and browse through the individual pages. I'll just scoot over here. That's a bit better. I can see myself better there. Please take note of the Health Pathways slide that we have up there that's relevant to this session that you can see on this screen. So Health Pathways is an online platform designed to support primary care clinicians in the assessment, management and referral of patients according to best evidence and consideration in local context. West Vic PHN have approximately 850 clinical referral and resource pathways available to clinicians in our region, and the login details are available in the Health Pathways handout and in the discussion box to the right of your screen as well. So if you have any questions during this session, we'll keep them to the end, but just type them into the live Q&A box and we'll spend about 7 or 8 minutes towards the end of the session discussing those. Any general comments, pop them into the discussion forum. So first of all, I would like to welcome, I'll start with Marg Dempsey. Many of you would already know Marg, but Marg is an experienced registered nurse with an extensive background in emergency and primary healthcare nursing, including clinical, educational, administration and facilitation roles. Margaret passionately advocates to strengthen the role and utilisation of primary healthcare nurses to foster improved health outcomes for people. She is currently embracing the opportunity to support nurses participating in APNA's Building Nurse Capacity Nurse Clinic project. And I'd also like to welcome Jo Millard today. Jo is also part of the Australian Primary Healthcare Nurses team, leading quality and excellence in primary care nursing nationally. Jo has contributed to a number of innovative state and national health projects and was clinical team leader for a large rural Victorian general practice team and is establishing a women's health clinic and access to MTOP services. Jo is a previous board member of Women's Health Grampians and has a keen interest in gender equity, social justice and family violence prevention. So I'll throw over to the speakers. Thank you.
Thanks very much, Linda, and good morning, everyone. And thank you to West Vic PHN for inviting APNA to participate in this year's Primary Healthcare Refresher. As Linda introduced, I'm Margaret Dempsey and I'm joined today by my colleague Jo Millard. We're both registered nurses currently working with APNA. We welcome you to this session where we will explore the nurse clinic concept, utilising the 8 nurse clinic building blocks to guide you. Firstly, on behalf of APNA, we would like to acknowledge the traditional custodians of the lands across which we live and work and pay our respects to their elders, past, present and emerging. We also welcome today's audience throughout the lands that the West Vic PHN region represents and other traditional lands that audience may be joining us from. I'm located on Wadawurrung country and welcome to my colleague Jo Millard.
Thanks, Marg, and hi, everyone. Today I'm coming to you from the Bunurong, Boonwurrung, Wurundjeri Woiwurrung peoples of the Eastern Kulin Nation.
Thank you. So let's get started with today's session. Before we get into discussing how nurse clinic building blocks can guide you to establish the nurse clinic, let's define what we're actually talking about when we use the term nurse clinic. So simply, nurse clinics are nurse-delivered, team-based models of care, and they offer an alternative model of care delivery where the nurse is the primary coordinator of care for the patient. So the nursing services provided are holistic and patient-centred. In the primary care setting, nurse clinic models support a team-based approach to care delivery. And of course, they involve the GP and other members of the team, which may include allied health providers or the non-clinical team members at your practice. It's a coordinated approach with nurses at the forefront of coordination. With an ageing population, the burden of chronic illnesses, and increasing complexities of care, the healthcare needs of Australians have changed, and especially so with the COVID pandemic, as experts predict a tsunami of chronic illnesses may follow as people delayed healthcare treatment and perhaps into this year as well. General practices may therefore now benefit from exploring innovative ways to deliver healthcare. So nurse clinics are well placed to meet the increasing demands on the primary healthcare sector, and positive benefits may include improved patient health outcomes, better access to care, and decreased rates of hospital admission. So the key theme throughout this session will be the importance of the team-based approach to care. Successful nurse clinics rely on involvement from the whole of the practice team, not just the nurse. To get us started, I'd actually like to play a video of a real nurse clinic. So some of you might recognise Carolyn Gibson from Ballarat Community Health, which is located within your PHN region. Carolyn participated in APNA's Nurse Clinic project in 2018 to establish a memory health clinic. Hi Carolyn and the team, if she's watching or joining us today. So let's take a look at the video of Carolyn's Nurse Clinic.
My name's Caroline. I'm a practice nurse at Ballarat Community Health. We have 4 GP clinics and I work across all of them. I've been a nurse for about 14 years. I got employed by Djerriwarrh Health Services to actually set up a particular program caring for people with dementia in the community. And that's when I developed a real interest, because I realised that people with dementia and their carers, what they really struggled with was understanding what the doctor had told them or feeling like they hadn't been heard by the doctor. And so I really realised then that there was this huge gap with people being looked after. Shortly after that, I saw APNA had some information out around some grants and nurse clinics, and I just thought, wow, that would be a great opportunity to get some support to develop maybe a clinic around cognitive impairment and dementia. Today, memory health is integrated across all our activities, and particular in chronic disease management. People were worried that that was going to take extra work, and so it was working with people to realise, no, we just integrate it. It's just another thing that we're thinking about. Because I think I did feel anxious and a lack of confidence, I actually went out to people I knew in the community. One of the most important was Mark Yates.
When Caroline came up with the idea that practice nurses really could play a key role, we realised that it had to be something that all practice nurses were familiar with, so that when in fact a practice nurse is doing any chronic disease management plan, that's done with an awareness of cognitive impairment impacting on the information they were giving and the ability of that patient to actually enact the advice that that practice nurse gives.
Having him on board really gave me a lot more opportunity to be heard. Researchers, medical specialists, other nurses just suddenly heard about the idea and wanted to learn more about it. And so coming in and giving people some ideas that, no, you can talk about this and you don't have to upset someone, you could actually make someone feel better. I genuinely believe that the nurse in general practice has a hugely valuable role to play. We're the most trusted professional. We do have very intimate conversations with people. It's just really satisfying, and I go home feeling good about my day.
Are well placed to develop nurse clinic models and to consolidate and coordinate patient care. It's what we do well as nurses. Don't you agree, Jo?
Yes, Marg. As Carolyn mentioned, nurses are the most trusted professionals, and that happens year on year. We seem to resonate with the public and the community, and we do have intimate conversations with patients, which is such a privilege. Carolyn also reminded us that a team approach is a vital to success, Marg.
That's right. And I love Carolyn's quote at the end of that video. It's really satisfying and I go home feeling good about my day. Well, it's what we all aim for in our work, isn't it? So I hope you enjoyed seeing that video. Excuse me for a moment while we just work on resharing the screen so that you can see the presentation. Okay. Okay, thank you for that. We'll just do. Okay, so the next session, sometimes there's little technical glitches, but we'll just work through those as we go along. Okay. So in this next session, we're exploring the establishment of Nurse Clinic, utilising APNA's 8 building blocks to guide you. So in this slide, it lists the 8 Nurse Clinic building blocks. The building blocks help to ensure that you've considered the most important aspects of creating a nurse clinic. And a lot of the work's been done for you, so use these as a guide to help you. Here's some important points to remember. Although there are obvious similarities, each general practice or organisation as a business is quite unique. For example, a nurse clinic in a community health centre may operate quite differently to a nurse clinic in general practice or in a correctional environment. Or indeed, 2 general practices in the same street may operate quite differently. So there's not a one-size-fits-all model. So you can use these building blocks as a foundation to guide you, and you can adapt them to meet your own needs. Success will depend on developing a model that suits your local context, the needs of your community, nursing availability and expertise within your organisation, and your organisational capacity. So also APNA has a dedicated nurse clinic website that takes you step by step through these building blocks and provides example of real nurse clinics and funding models. So a lot of the work's been done for you, and I'll encourage you to have a look at the nurse clinic website when you can. Now I'm just going to pass over to Jo.
Thanks, Mark. So with all good ideas, we need a well thought out plan to support implementation. Remember, to establish a nurse clinic, prepare well, do your homework and discuss your ideas as a team. We've seen a great example just now and also great examples of team approaches by practices in preparing for the COVID-19 vaccine rollout. To identify population health needs, we need understanding of our community's health needs to help define the target group for our nurse clinic. Knowing the target population cohort will also enable you to determine the use of best resources to support that group. Data sources may include, of course, connecting with your primary health network. And the primary health networks are wonderful at identifying demographic data and population health needs for your region. So, for example, it may be the Geelong region, or more specifically within the Geelong region, sub-regions such as the Bellarine Peninsula or the Surf Coast Shire. Resources that you might find useful as well include the Australian Bureau of Statistics, Australian Institute of Health and Welfare, and you may use your clinical software systems and clinical audit tools such as PenCS to extract practice data, which provides insights into your patient population. Tap in and connect with your PHN to optimise the support that's available to you. You may also choose to start off with the PIP-QI measures. And if you're not sure about those, just put in your search engine PIP-QI and guidelines and criteria. And that can be a starting point. So it could be that you start off identifying your Aboriginal and Torres Strait Islander status, and you may identify that there is a health need there. In determining your patient cohort to decide on the type of nurse clinic that you want to establish, it's useful to focus on lifestyle. It might be lifestyle modification, general chronic disease management. It might be that respiratory health is a key focus, or a population health need in your area. You may have a need for women's health clinic, men's health clinic, healthy ageing clinics. These are all just ideas, but it's really important that you're informed. And it's really important also to determine the aims and goals of any clinic that we're setting up. Developing goals provides an opportunity to consider exactly what it is that you're seeking to change. And this will help keep the whole team focused and encourage motivation. And we've heard in other presentations we've done that if it's not measured, then we don't know how to measure success either. And if it's not measured, it doesn't happen. Many of you will be familiar also with the SMART goal acronym. So these are the goals that are specific, measurable, attainable, realistic, and time limited. And this planning method is evidence-based and used by businesses and individuals to keep themselves on track. So for a respiratory example, for a SMART goal, we may have an aim of a target cohort of 100% of patients under 25 years diagnosed with asthma that will have a current asthma action plan within the next 12 months. So that's just one example. And also, we were contacted at APNA with a nurse looking to start up a clinic as an example, and they were very keen to have a youth sexual health clinic, but in the end it was determined that they actually had an older population, and so they had to go back and review that. And now over to you, Mark.
Thanks, Jo. So the next building block that we'll talk about is location and facilities. So you need to consider the space that you have at your organisation. Is there a dedicated room allocated for the nurse clinic to ensure patient confidentiality, privacy, cultural safety? The treatment room may not be an ideal environment, perhaps especially if you're running a youth sexual health clinic, for example. You also need to think about the operating hours of the nurse clinic. Will you run it on set days of the week, or will you integrate the nurse clinic into a daily work schedule? The type of clinic you're running may help you to decide this. Can you be flexible to reach your target audience? So, for example, a youth sexual health clinic might be best to operate out of school hours or on weekends to achieve best outcomes. Or the 45 to 49-year-old health checks can prove challenging cohort to catch, as these people might often be working, caring for children, or caring for elderly parents. So you may need to think about the best time to run that clinic. Another point to think about is, do you have all the equipment that you need to run the nurse clinic? So appropriate clinical equipment to measure height, weight, blood pressure, perform eye tests, etc. Access to emergency equipment, of course, is vital. And consider infection prevention measures, adequate hand washing facilities, and do you have enough physical distancing space? Do you have any education and demonstration equipment that you need? So if it's a respiratory clinic, having puffers and spacers is important. Or perhaps if you're running an osteoporosis bone clinic, to have those bone models where you can show patients the example of healthy versus unhealthy bones. So considerations will be different for each clinic according to staffing, space available, and the type of nurse clinic that's implemented.
So next we're looking at systems and processes to set up a system to ensure that the clinic is running efficiently and supports success is really important. So this may include developing or modifying policies and procedures so that the team is all on the same page. Develop a responsive and flexible appointment system. So it might be engaging the whole team, utilising the strengths and skill sets of the admin staff for support. And remember, it is a team approach that's going to help build success. Consider, do you require longer time for consultations? Does your appointment system enable this? What planning needs to go into that to make it happen? Is there a strategy for staff leave or absence to ensure continuity of care to run the clinics? Create processes to manage patient recalls and reminders for the nurse clinic. And a reminder, as you may be aware, are used to initiate prevention for patients. So it might be chronic disease management review appointments, specific nurse clinic appointments, and it may be done as a courtesy phone call or message the day before. Depending on your nurse clinic, a system approach for reminders may include health assessments, asthma review of action plans, spirometry where it is safe to provide this, inhaler device education. And recalls are a proactive follow-up to preventive or clinical activity designed to enable the patient to receive further follow-up for matters of clinical significance or importance. And we also need to consider data information and management. So use our data extraction tools such as PenCS to search for eligible patients. So it may be that example that we gave, patients under 25 with a coded diagnosis of asthma. Of course, the Primary Health Network can assist you if you need support with data extraction tools or support your understanding of local population health needs. And I think that Westvic PHN provides quarterly population health benchmarking reports. Discuss this with your practice manager or contact the PHN if you don't have access to the information. So next we're moving to talk about the next building block, which is best practice care. And firstly, it's absolutely essential that we always work within our scope of practice. And that's professional scope of practice and individual scope of practice, and ensure that our colleagues, so the GPs that we're working with in our team and practice managers understand exactly what our scope of practice is. So we can't expect others in our team to understand what our legal responsibilities of practice are. We need to be across it. And as clinicians, GPs may make it their priority to understand their legal requirements, but they may not understand ours unless we're prepared to have these discussions with the team. It's your responsibility to ensure that you're working within the professional codes and guidelines outlined by the Nursing and Midwifery Board Australia. And if you need to know more about scope of practice, refer to the MBA standards and codes of conduct. And APNA also has an online learning module, which is a scope of practice 1 hour module for you to look into. Clinical guidelines and protocols assist clinical staff make evidence-based decisions about best care and treatment options for patients. Evidence-based clinical guidelines can be found in the following areas. So there's a vast array of them, but these are just some of them. So it could be peak professional organisations such as National Asthma Council, Diabetes Australia, Heart Foundation. So it could be that the respiratory nurse clinic, we may need to keep abreast of recommendations about performing spirometry. And we know that here in Victoria, during COVID, we have had real restrictions on spirometry due to safety considerations. So you may want to check in about the National Asthma Council guidelines and their pandemic response. So there's peak organisations such as Asthma, of course, that's a blatant plug. Are you a member of APNA? And we do have some wonderful resources and online learning. So that we're a professional body that works for nurses working in primary health care. Before establishing your nurse clinic, consider conducting a literature search to review what's best practice so you're well informed and what the current guidelines are for the specific clinical condition that you want to be providing care for in your clinic. It's really important that wherever possible, because we're busy, we avoid reinventing the wheel. It's really important that we embed quality improvement approach into any nurse clinic that we're establishing so that we contribute to the delivery of safe and quality patient care, and that we provide service and measure efficiency, viability and effectiveness of the services that we're providing. And I think I mentioned before that what gets measured gets improved. So many of you will be familiar with the PDSA or Plan, Do, Study, Act cycle. It's a quality improvement cycle. So plan the change that you want to implement, carry out the change, study and evaluate the impact of the change, and then act on any changes needed that need to be planned and occur. And then you go back through the whole process again, so there is a continuous cycle of care. So it's really important also that you celebrate success and remember to celebrate with the team any milestones that you achieve. And now it's a quick opportunity to have a bit of a stretch before Marg carries on with the next building block. Thanks, Marg.
Thanks, Jo. The next building block we're going to talk about is patient engagement. So how will a patient move through your nurse clinic, and how will you promote the nurse clinic if this is a new service? So consider the initial contact with patients. Will you send letters to invite patients to participate in your new service? Will it start with opportunistic invitations as patients enter the practice? Will you have signage in the waiting room or on the waiting room TV, a phone message as your on hold message? Does your organisation have social media to keep patients updated? Will you put ads in the newspaper or perhaps some radio advertising? Will you create brochures and flyers to support this new service? So you just need to think about what will work for you and your patient cohort. And think about how you'll keep your patients informed. A lot of thought needs to be given to the health literacy of the community that's accessing your nurse clinic. We know that helping patients understand their own health can lead to increased patient empowerment and better health outcomes. Initial interventions to assist health literacy may include promotional material to suit the target cohort. So think about the language used. Is it culturally appropriate? Is there translated resources if targeting refugee health or linguistically diverse communities? And raising awareness amongst all the staff to ensure that the practice team have a solid understanding about how the nurse clinic will work. And remember the theme of today, it's a team approach. Considering confidentiality and consent. So you'll need to ensure that you address any issues of confidentiality or any consent required that might arise during the implementation of your nurse clinic as required. And referral processes. Develop a referral process into your nurse clinic. How will that happen? Will it be internally from the GPs? Will it be external from local service providers or community groups, or perhaps school groups? If we think back to that youth sexual health clinic, maybe promoting through some nearby schools might be the option. And another example that we're seeing is the establishment of iron infusion clinics within general practices, which is aimed to decrease current waiting times for appointments at local hospitals. In a couple of these examples that we're seeing, external referrals are accepted from other general practices with discharge letters sent back to the patient's usual place of care following the procedure. The clinic that has set this iron infusion up also connected with their PHN to have their iron infusion service listed on their local health pathways site. So now we'll look at staffing and HR. We'll aim for success to build on strong teamwork and culture. Working in primary healthcare is consistently busy, and currently there are added pressures around the way we work. I don't need to tell you that. So remember, the team approach is vital to share the load. Successful nurse clinic is dependent on having the right staff, both clinical and non-clinical, to support establishing the clinic. And you'll need to establish clear roles and responsibilities to reduce staff discontent and help cement a more cohesive and collaborative staff culture. Remember, we're all in this together. Accreditation requires us to have clear position descriptions for staff. And so ensure robust HR policies and planning to meet the needs of staff relating to the nurse clinic is in place. Is there any specific training required to run the nurse clinic? Have you addressed staff leave cover for the nurse clinic? Because after all, we do want to have a holiday now and then, don't we? Ensure rostering adequate staff numbers when running nurse clinic sessions, with consideration to available space, operating hours, and clinic needs. And will the clinic run in conjunction with daily practice appointments, or will it be more standalone at a different time? Consider if any additional education is required relating to the nurse clinic. Clinical staff may need to upskill. If there's any additional training for non-clinical staff that's required, that's specific to running the nurse clinic, you might initiate a different billing system connected to the nurse clinic, and there may be training required for that. And also remember that APNA do provide a range of online learning for both its members and the wider healthcare nurse workforce, as does the local PHN. So once again, remembering that it's a team approach. Now I'm going to get on to the interesting section, of course, which is funding. Everyone always wants to know about funding. And there's lots of discussion about how nurse clinics can be funded to ensure viability. And I think often the confusion comes from not understanding the nurse clinic model. So remember that the nurse clinic model supports a team-based approach to care delivery, which includes the GP. It's a team. It's a coordinated approach, not standalone, with the nurse at the forefront of coordination and health professionals all playing their part in patient care. So the fundamentals of funding a nurse clinic relate, of course, to income and expenses. So identifying sustainable sources of funding is critical, as is the need to cover ongoing costs. And we heard Brett McPherson speak yesterday's session about general practices are businesses. They're small business, so these are considerations that need to occur. Expenses to consider include establishment costs, nurse salaries, operational costs, equipment, administrative costs, marketing and training. And when you're thinking about the income source, our current healthcare model relies heavily on revenue from MBS items, focused or available to nurse practitioners. But what other funding might be available? Federal government funding includes MBS, as I've just said, and the workforce incentive payments to the practice. Joe mentioned previously about the PIP-QI measures. But you can also look outside of those standard funding models. There might be grants available from external organisations. So being involved with APNA projects, PHN initiatives, local council, local hospital networks, or private sector organisations. Or the nurse clinic model might be supported by patients who pay an out-of-pocket expense. And in the iron infusion example that I gave previously, patients pay a fee for service, and they do so to avoid long wait lists at the acute hospital. So they do have a choice. You may want to be creative and look for organisations to partner with. And I'll give you an example of a general practice that's located in the Huon Valley in Tasmania, and the practice is owned by a nurse practitioner. They established a men's health outreach nurse clinic, which receives some financial support from a large local business that employs a high proportion of men. The business saw benefit in collaborating with the general practice to provide and subsidise annual health checks to its employees as a part of its wellbeing program. So the benefits for that business included healthy staff, and it led to staff retention and decreased sick leave, and therefore increased productivity. But it also led to a healthier local community. So there's some considerations thinking outside the mainstream funding models. When we look at MBS funding, we've spoken about that, but it's important to have a solid understanding of relevant MBS items that are claimable. The Medicare Benefit Schedule is the source of truth, and I love those three words, source of truth. So if you're uncertain, that's where you need to go to look at to make sure that you're meeting the eligible claiming criteria that's noted against the item numbers. If uncertain, you can visit MBS online or Ask MBS, which is the email service for health providers. I do encourage you also to access the document produced by the Department of Health. It's called Questions and Answers on Chronic Disease Management Items. And it's my go-to document as a great resource for understanding chronic disease management, claiming criteria, and eligibility for services. So I do urge you to have a look at that if you're unfamiliar with setting up chronic disease management model at your practice. And APNA, this is the good news story. APNA's also made navigating your way around financial aspects of running a nurse clinic much easier with the development of a nurse clinic budget template tool. The interactive model shows you step-by-step how to estimate financial viability in your nurse clinic by importing information into an Excel spreadsheet. The template is set up in 3 sections: an income calculator, an expenses calculator, and the summary section to identify a profit or loss based on the sessions that you run and the information that you put into it. So each general practice is unique and will have differing factors which influence funding models. And this is the beauty of this budget tool. You can put in your own information specific to your context. And I'll show you where to locate that on the Nurse Clinic website shortly. But now it's over to Joe for the final building block.
Thanks, Mark. Yeah, final building block, but a bit more information to share and an exciting video coming up. So we heard earlier that what gets measured gets improved. Evaluation is a systematic approach using evidence-based criteria to measure how well, in this instance, nurse clinics are achieving its purpose and aims. So evaluation of the clinic is to ensure we're actually achieving our aims. So we might start slowly with a small number of patients and then review the processes, what worked well, what could have been improved. So we need to be discussing as a team and reviewing accordingly. And I'd also encourage you to include patients. You might have patients that you know that will give feedback that will be supportive. So patients are part of our team as well. So important to get their views on things. So you might start off and have a patient providing a bit of feedback as a first person into the clinic that you're establishing. Collect and analyse data, develop a clear definition of success and work towards that criteria to help you measure that success. So for example, it could be number of patients seen, number of health assessments conducted, number of heart health assessments, number of care plans reviewed, number of asthma action plans completed. Could be clinical data set measurable factors such as HbA1c, BMI, blood pressure, height, weight. So, for example, for a respiratory clinic, you could measure the number of patients in the target cohort seen and reviewed that have up-to-date spirometry data recorded and that their inhaler technique has been assessed to assure that the delivery of the medication is correct and that they have an update action plan as well. So you might want to discuss findings as a team and develop and implement an action plan related to your nurse clinic model. And then reevaluate. It's a constant process. It's a cycle. Remember that the PDSA quality improvement cycle that we discussed earlier, and it allows us to test the idea that we're working on. We may not get it right the first time. We may need to keep refining. So the patient experience is really important, and how, as I mentioned, and how will you know if the nurse clinic is going well? So we need to ask the people that it's designed to support, the patients. So there are several ways to achieve this. So a simple, cost-effective method is gaining feedback through a survey. And one of the tools that's available on the site that Marg's going to be showing you in a moment is the patient enablement and satisfaction survey, or PES as we fondly shorten it to, which was developed by the Australian Primary Healthcare Research Institute in 2011. And it's been specifically developed to help nurses evaluate nursing care by seeking patient feedback and ask patients about their experience of the nursing care provided, and can be offered to patients after they've visited the clinic. Remember, changes to systems and processes and structures within your practice are best achieved as a whole team approach. And remember to include the patient as part of that team.
So thanks, Jo, and thanks to everyone for joining us. We're not quite finished yet, but now I'm going to show you a quick tour of APNA's Nurse Clinic website, where there's a lot of resources available and a lot of the things that we've been talking about are there. So just bear with me while I move to sharing my screen for the Nurse Clinic website.
Mark's just taking us to the APNA website, the Nurse Clinic website, and it's a fabulous interactive website with wonderful resources. And off you go, Mark.
There you go. You can see it now. That's great. So this is the APNA's, it's a dedicated Nurse Clinic website. So it's quite easy because there's only a few tabs to look at, and you'll be able to search information. So when you're looking at setting up a nurse clinic, you just click on that and it will open up the building blocks that we've been discussing. And when you look at each building block, once again, each of those is interactive. So you can click on a clear plan, which was the first building block that Jo mentioned, and reading through, and there's some help and supports to guide you through that. You can also, if you're wanting to have a look at real nurse clinics, so this section here, real nurse clinics, it shows you case studies, and it's some of those that I've mentioned: an iron infusion clinic, chronic heart failure clinic that was run in West Australia, a respiratory clinic run in Mackay in Queensland, And if you're interested to know more about that, you can open up and read more about it. It gives you an overview. And when you look at it, also has a flow chart there, which gives you the aim of the clinic, the model that they introduced, item numbers that were utilised. And when you look here, the patient eligibility for that nurse clinic, what happened in the nurse clinic at the initial visit, and what happened in follow-up visits, and what kind of documentation was used. So there's a lot of good examples here in these real nurse clinics. And you can also, I'll just click it back. You can also then scroll through more. There's Indigenous health clinics, health clinic in the correctional service. And scrolling down to the bottom, there's the video of Carolyn that I showed earlier. If you're wanting to watch it again, it appears there on the on that site. So then looking at billing and funding, I mentioned that there was some tools to help you, and this is, I'd really like to highlight this. I know that perhaps the next session you're going to be hearing about business models in nurse clinics. So keep this in mind when you're listening to that session. We have billing and funding. There's the nurse clinic item numbers for, as a guide, the MBS item numbers to use. And it gives a guide for the type of the item number and what the claiming eligibility is, but also some notes about how nurses and the roles that nurses can play against each of those item numbers. We also have a nurse clinic budget tool, which I mentioned, which is the Excel spreadsheet. And when you open that up, you just need to open it up and save as, and then save it to your own device. And then any of the information that you put in about your own clinic, nobody else can see that. It's we can't read and see it, so it's all perfectly safe for you. So you can put in your own information relating to your clinic. And to help guide you to do that, I'm just going to click here on the budget tool instructions. So this is an instructional video, if you like, where you can just click on the arrows and just read through at your leisure, and do this with the nurses, practice managers, business managers. Work through this together, and it's a really helpful tool that will help you model the financial impact of funding your nurse clinic. So you just keep selecting through the arrows there and reading through. And the next one, it's going to show the Excel spreadsheet. And you can see here it's set up in 3 sections. And you hover over the sections highlighted for more information. So when I hover over income calculator, it gives me an explanation. When I hover over the expenses calculator, or the summary that shows the profit and loss. And you can continue to keep moving through this learning module. You can't break it, and some of the cells are locked and can't be changed, but a lot of the cells can be changed. Like over here, if you were thinking in your session of having 2 management plans being conducted in that session, you put in 2, or maybe you're going to change that to 3 or 4. And as you change it, it will alter the billing and calculate for you. So it's a really handy, helpful tool that I really encourage you to have a look at. And just the other point to show you as well is tools and resources. So under each of the building blocks, there are some tools and resources. There's also lists of different webinars that have been recorded that may help you with that. And having a look, when you look at best practice care, there's the PDSA template that Joe mentioned earlier. So a lot of the work has been done for you. And I think with this new website, it's easy to find. And under evaluation and improvement, there's an example of the PES, the Patient Enablement and Satisfaction Survey. And this is an example of one that's completed. The reason for visiting the nurse clinic, in this case, a diabetes clinic, and it asks patients to score their experience of visiting the nurse clinic and also their level of enablement following their visits with the nurse. Do they feel that they are now better able to understand their illness, to cope with their illness, and how confident are they in their own health? So it's a great useful tool for you to use as a part of an evaluation. So that's the nurse clinic's website. And I think we're back to, back to the presentation now.
And I think we were going to move to the video, Marg, quickly. I think, weren't we?
We are. So before we finish up, we're really excited to show this video. This is the first time it's been seen, so worldwide premiere. And in this video, your local GP and Westvic PHN Board Director, Dr. John Barrell, speaks to the value of establishing a respiratory nurse clinic at Springs Medical Centre in Daylesford. And team leader nurse Leanne Potter also features in the video. So Springs Medical participated in APNA's nurse clinic project to run a better breathing wellness clinic. And so I'd like to give a shout out if any of the Springs Medical staff are attending this event today. So I'm delighted that this is the inaugural viewing, and it's exciting and appropriate that it's taking place within the PHN catchment that it was filmed. And I must say that Daylesford turned on a spectacular autumnal day for the day of filming. So let's watch the video.
I'm a GP here at our Daylesford rooms. This is a part of Springs Medical Centre, which is a privately owned, multifaceted general practice here in the Central Highlands of Victoria. We're nestled between Melbourne, Ballarat, Bendigo. We started the nurse-led Better Breathing Wellness Clinic a couple of years ago, and with the intention of doing respiratory management better. One of the big pluses of the Better Breathing Wellness clinics is that generally the nurse appointments are about 30 minutes in duration. Commonly there's at least 2, maybe 3 sessions with the nurse. There's an initial assessment visit, taking some history. That middle bit, that 10 minutes in the middle between administering the Ventolin, the salbutamol, the bronchodilator, and then doing the second test is an ideal opportunity for the nurses to spend some time with the patient doing general conversation, asking how they're going, asking what resources they've accessed, assessing the severity of their breathlessness. And I think the patients really find that valuable, that whereas with the traditional model, they would seldom get 30 minutes face-to-face time with their doctor. In this model, they're getting 30 minutes of face-to-face time with the practice nurse and still a consultation with the doctor at the end of it. I think the patients really value that enhanced service. I often mention one of our star patients who had pulmonary fibrosis and was on oxygen and was lining up for a lung transplant, and having passed through the Better Breathing Wellness clinics and then attending the Spring in Your Step rehabilitation program, is now off home oxygen and is no longer on the lung transplant list and is an active member of community. Dipping your toe in the water with one chronic disease activity, could be diabetes, could be respiratory, can lead to a range of other benefits for the clinic where you're not so much focused on traditional one-to-one doctor reactive medicine, and you're much more focused on enabling patients to do things to improve their well-being. Further advantages of the Better Breathing Wellness clinics has been an enhancement of the skill set within our clinical team, and I think also an improved general well-being for our entire practice team, including the doctors. I think there's also been a community benefit, and again, success breeds success. People like talking about success. If we start delivering respiratory medicine better, then patients will talk with their friends in their social network. There will be other people in that network who are also on puffers or other treatments for respiratory illness, and they might have previously given up hope of a better outcome, and they might be encouraged through someone else's improvement to think, oh well, maybe things have changed, maybe I should give it a go. So we saw a need for doing things a different way, and the patients really appreciate the involvement of the practice nurse. They see them as part of the team, and so a regular review with the practice nurse and the doctor, I think, delivers better results.
Thank you, Marg and Joe, for that. We've got 1 minute and 7 seconds to go in this session, and I just really want to there's a couple of questions there, so I'm just going to tackle those. Sonia, I think you'll find all the answer to your question will be on the Nurse Clinic website. And Tracy, I know from the PHN's perspective, we've got a wound clinic project happening up in the Wimmera, which has got an evaluation framework wrapped around that with some research around that as well. But if you want to drop me a line at the PH, I'm happy to have a chat. And I think the Building Nurse Capacity project also has a research framework around that. So there's going to be lots of learning from that project as well. So thank you all again very much. It's been an amazing session. There's so much information in the building blocks. I know there's the 8 building blocks. It's a really great framework to talk about setting up a nurse clinic, and I'd encourage you to head over to the APNA website and have a good look at it. So I think we'll end the session there. Thank you very much.
Thanks, everybody.
Thanks, everyone.